Behave.
All right. And on that note, I would like to call the meeting to order. This meeting is being, oh dear, that is awful. I'm so sorry. Okay, got that, I think. Quiet. This meeting is being recorded by the City of Greenfield. If any other persons present are doing the same, you must notify me at this time. And I do reserve the right to remove or have removed any person or persons for profanity, threats, or any continued disruption during a meeting. Okay. Roll call. For those of you who, I think most of you know me, Nancy Bershoff, I'm the chair of the Board of Health.
Melissa Balbona, member.
Okay.
Kelly Dixon, member. I'm on my phone. I have a very small screen, so if I overtalk, I apologize.
Jen Hoffman, Health Director.
Nicole Glayback, Health Inspector.
Great. Okay. And thank you, guests, for attending. First item of business is to approve the minutes of November 3rd. A motion, please.
I'll make a motion to approve the minutes.
Thank you.
I'll second that motion.
Okay. Any discussion of the minutes? Problems with it? Okay. All those in favor?
Aye.
Okay. Minutes approved. All right. Moving on to a very important item for our board, and a sad item, which is that the term that Kelly Dixon has been serving for a number of years now. 3 years? Four? How many years?
Little over 3. Yeah, August.
Hard to count. Kelly's term is ending. She's stepping down, and we'd like to offer some thank you from the board, and I'd like to ask Jen if she will read the letter that we prepared to acknowledge that.
So Kelly, you are not driving, correct?
No, I'm just in a parking lot.
Okay. So, dear Kelly, this is a letter of appreciation for your service on the Greenfield Board of Health. You have served through 3 health directors and 2 mayors. Pre-COVID, a mere 3 years ago, your guidance made a difference to the health of the residents in Greenfield on topics ranging from restaurant safety, tobacco regulations, and the homeless. Your great love for others shined bright. Then your role pivoted to serving as the chairperson for the Board of Health during the COVID-19 pandemic. There were so many unknowns. Guidelines from the Commonwealth changed almost daily, and fear was rampant. During this dark time, you showed strength, dedication, compassion, and at times had to make difficult and controversial judgments. Despite all of this, and despite hurtful feedback from the public, you faced these challenges with dignity and pride because you believed, and still believe, the good in the workings of the health department and what you were sworn to do, to protect the residents of the city of Greenfield, and you took your oath seriously. The compassion that you have shown the people in Greenfield and in the surrounding towns is a great inspiration to us all. The board recognizes that you have always treated everyone with kindness and respect, no matter what the situation was. The health department and the Board of Health know and understand how stressful it is for people who find themselves in the need of the services that we offer. Your words and actions have helped the vulnerable and those in need keep their dignity. The health department wants to inform you that your effort has not gone unnoticed. Along with being the chair of the Board of Health, you worked in the Emergencies Operation Command Center, or the EOC. You worked endless hours with contact tracing, protocol management, and keeping up with endless updates. When speaking to the public, you spoke to each person as an individual, but kept in the forefront of your mind that the public at large was the focus. By protecting the public, we ultimately protect the individual. By being part of the EOC, it made you more steadfast to help keep COVID under control by educating everyone to stop the spread. After working at the EOC, you resumed your role as a board member with your professionalism, extensive experience, thoughtful insight, and perspectives on protocols, mandates, and regulations. You have always kept an open mind on every issue seeing both sides and every concern. You would not allow any personal feelings to interfere with the challenging decisions the Board of Health needed to make. On behalf of the City of Greenfield, the Board of Health, and the Health Department, we would like to thank you for volunteering your time and energy for the betterment of the health and well-being of the residents of our community. Sincerely.
Thank you so much.
Thank you,
Kelly.
Jennifer, and the health department and the board. I'm glad you asked me if I was.
Oh, you're
I wasn't
well.
expecting that at all. I actually wasn't expecting any of that. So I really appreciate the very, very kind and gracious words. It's been my honor.
Well, they're all true. I, for one, was very happy to have you where you were when we really needed you there. So,
Yeah, well, I was as well, and I really do appreciate all the opportunities that came with being a member and chair of the board, and also working with everyone at the EOC. You know, it was a very stressful time, but it was also just a time of understanding and nurturing and discovery, and you know, I think just finding ways to work with each other to make things happen for the city. So, and it's, you know, residents. So I really appreciate the opportunities and the time that I was on the board.
Thank you, Kelly.
And I would just like to add, Kelly, you and I overlapped a little bit right in the beginning. And then, you know, when there was that transition, it was so difficult. You know, you had just come back on the board as a board member, and you had been the chair previously. And, you know, there was all this sort of switching around going on, and you were just really cool. You know, you just managed the change and, you know, all the things that Jen mentioned in the letter with such grace and calmness. And I've so much enjoyed working with you, and I'm sorry to see you go. And I understand.
I'm sorry as well, but I do feel like it's my time, and it's time for somebody else to be able to join the board and do amazing things for the city and for the board and the health department.
Great. Well, thank you. Thanks.
Yeah.
Thank you. Well, and that brings us to a new member appointment by the mayor, Samantha McIver. I didn't say, Mayor, that I would be mentioning her, and I don't know anything about Samantha, and I don't know if you have anything you want to comment on at this point, but I assume she'll be ready to step up at the January meeting. She has to do some things in order to get there, right? Read the regulations, be sworn in, and so on.
she has to be, the process for appointing members to any board is I submit the names to the city council. And then the council, they don't necessarily approve, but they move not to disapprove or something like that. It's a very strange process. But it does go through them first, and they will be looking at all the names that I've put forward, including Sam's, for various committees at their December meeting on the 15th.
On the 15th. Okay.
And then there is a waiting period, and I never remember exactly what the time frame is, but it's a few days. You know, it might even be as much as 30 days before they can be sworn in. I don't know if that's to give them an opportunity to say, "Oh my God, what have I done?" or if it's just a process. But nevertheless, I would think certainly by the February meeting, Samantha would be ready for you. And you can certainly always, once she's approved by the city council, you can certainly always reach out to her and encourage her to come, you know, to come to a meeting even before she's sworn in, just so she has a sense of how you all operate.
Okay, well, we will, I'll definitely do that.
Okay.
Make that effort.
She happens to be the wife of Peter McIver, a captain in our fire department.
Thank you. Okay. Next on the agenda is the COVID update, and Jennifer and Megan you would handle that one, please.
Megan?
Jen, you have the most recent numbers from this morning. Did you want to go over those or do you want me to pull them up quick?
Sure, I have them. Let me get them. Hold on. I can find it. So the numbers are our total caseload, total numbers the whole time is 1,261. Our cases in November were 162. We had one death. As of 12:15 this afternoon, that was the last time we counted, it was 91. Massachusetts overall, their percent positivity is 4.46, which is extremely high. The update for Greenfield, the last time it was posted was November 25th. The 14-day average incident rate was 26.7 with a percent positivity of 2.66. But again, that was several days ago. And that's as of those numbers, but I didn't know if you wanted to give any other numbers, Megan, or information.
Can I just ask a few questions? So the total caseload, 1261, is since the beginning of the year?
Yes. No, since it began,
Oh,
2020.
okay.
since
Okay,
2020.
okay. Let's see. Percent positivity, we had been running like 1.9, maybe 2, around that. Is that
At
right?
the highest. It hasn't been this high for a while for
Yeah.
Mass, yeah.
Yeah. Okay. Okay. Yeah, Megan?
One of the other things that I just wanted to mention is, so when I did the counts this morning before Jen's updated numbers, I had 155 cases in November. 67 of those were fully vaccinated. So the other 80 something, 88 or whatever it was, were unvaccinated. So it's almost 50% of the patients that are positive are fully vaccinated. So in my opinion, that's why it's so important to layer our protection, like social distancing, masking, everything that we can, because the vaccination alone is not good enough.
Megan, I had a quick question. Are they capturing any data on boosters, if anyone's had a booster or not?
Yeah,
So
a
those-
lot of these cases are fully vaccinated with boosters, and they're still coming back. And even the cases that have recently had 2 vaccines, so say they got vaccinated in August and September, and then they're positive in November. So it's not really making a huge difference.
Which
Would
is
you
very
say it's
concerning.
making a difference in the severity of people's?
No. The last time I did a count, there were 5 deaths. 4 of those were fully vaccinated. This month we had 1 death, and that person was fully vaccinated. So I don't think it's making a big difference. People seem to be getting just as sick as everyone else. And, you know, that might not be the trend nationally, but that's definitely what I'm seeing talking to patients every day.
And as for hospitalizations, Bay State Franklin has been steady, but they transfer a lot of their patients to Bay State Springfield because they just have more ICU beds.
Right.
So and a lot of people though do go through the ER. I was sending that information over to Nancy, and there's different treatments now. So they treat a lot of them. They treat and release, and then watch, and then we keep in touch with them and monitor if they turn positive.
The awareness that I have kind of following other trends is that the range of vaccinated people who are coming down with COVID, the range is from 20% to 40%. So 50%, I think, is pretty high, Megan, that you mentioned. It's definitely, much higher than it was in the beginning. Well, after we've had our first really solid months of vaccination rate and before the Delta variant really took hold, there were many fewer cases among those vaccinated, but of course that's changed.
So Nancy, I think part of the problem with reporting overall through the whole state and probably even the country is that when the data comes into Maven, the reporting system, it's supposed to link with MIIS, the reporting system for vaccinations. So we're supposed to see all of the vaccinations that they've had. They're supposed to come into Maven for COVID anyway. But they're not doing that. It's just not happening. They come in, but maybe they only have one vaccine that came through because maybe they had a junior, or maybe one they registered with Chris and the other they registered for Christopher or something like that. So the state data looks like there's a lot of people that have COVID that were not vaccinated, even though they really were. You just have to dig really deep. And because we had the CTC, they didn't dig deep like we do in our health department because we have the resources to do that. A lot of the people on the CTC, they don't even have MIIS.
CTC, what's that?
The Community Tracing Collaborative, that just ended. Today was the last day, or yesterday was the last day for them. So I think that's why the state data doesn't look exactly like what we're seeing, because we're digging deep and saying, like, we're making calls to every single person saying, are you fully vaccinated? When was the date of your vaccine? And we're entering that.
I see.
Where they're not doing that in the state.
And what about people who have comorbid conditions? So other conditions that, what are you seeing with that?
It's really not making a big difference. The one death that we had a comorbid issue this month. So that one I wouldn't necessarily say they died from COVID.
Yeah.
But,
Okay.
I don't know how much more I can say without.
Yeah.
Like,
Mayor.
Did you acknowledge me?
I
Oh,
did.
okay, thank you. Megan or Jennifer, whichever one of you has the information, could you give the age range of the patients that we're seeing, or the people that we're seeing who are sick?
that would take a while, but none of these patients are nursing home patients that I'm working up now. They're all community members. Most of my patients are school age, preschools, and then the 40, 50-year-olds. But I don't have very many patients at all that are over 65.
I would say that is the 40 to, I mean, that's when I do that, when I look that up, it's usually in that range.
Right. So that I wasn't necessarily asking about people age 65 or older, but just to get a sense of who is getting infected right now by virtue of age group. So because it is sort of interesting to me that it is a younger crowd of people than I think maybe we're seeing in 2020. Not to say that there weren't people of all ages getting sick then too. It does seem to be a little bit of a younger group of people. By that I mean, anywhere from children, as you say, on up to 35 and 40-year-olds.
I think that makes a lot of sense. Oh, sorry.
Sorry.
I'm not necessarily ascribing anything to that. I was just curious.
So one thing that I should just kind of mention too is that the school age children we have, I haven't seen any transmission in schools so far. So the school age children are getting it from their parents or, another adult. They're not getting it from other children in school, from what I've seen so far.
And you said, when you were talking about the age ranges, you said half were preschool aged?
No. Half of my total cases are between school age and preschool age.
Between.
Yeah. And then the others are like the 40, 50-year-olds. Sorry.
That makes much more sense. No, that's okay. I do just sort of separate from a little bit from this discussion, because this is a public meeting. I do just want to say that overall, even though what we're seeing here sort of locally is maybe different, vaccination does tend to produce a less severe disease. So I just, the public meeting, and I don't want people to sort of give up hope on vaccinating our way out of this problem, however many boosters we may all get.
Well, I think when it comes to vaccination, Alyssa, to your question, I think that,
Oh,
again, it's a
I
herd
didn't
immunity. No, I think that we are
ask a
for
question.
vaccination. I think though
Yeah,
that it's the herd immunity and we could
totally.
totally go into global equity and that's a whole other discussion. But I think that we need to keep in mind that, we know the range of Greenfield residents that are vaccinated, and it's not where we would want it to be or expect it to be. And I think that if more people were vaccinated and really took to the call, the spread wouldn't be as significant. And we're not even
Yeah.
seeing the Thanksgiving rise yet. This is not even that. So
Yeah, no, that was not, yeah, that was just an encouragement to folks, nothing else behind
no,
that.
I absolutely agree 100%. I mean, we still absolutely strongly encourage everybody to get vaccinated without hesitation, because we need everyone to get vaccinated.
Okay, great. Thank you. Thank you for the information, for the update. So that brings us down to the mask mandate question, and I put this on the agenda because it's a conversation I want to have with the board, with our mayor. We have been talking about it, and I'll just say a little bit about my process, which is as I looked at bringing this up and making offering a motion for a mask mandate, I wanted to dig a little bit and find out what our authority is as a Board of Health. And we spent some time, Mayor and I and Jennifer, discussing it and then getting input from our legal team. That we do have the authority, but there needs to be a public notification. They're also having looked at an example from another city, some considerations about the scope and the wording and so on. So having gone back and forth with this, I would like to offer a motion, and then what I would like to do is just read the motion, and then we can look for a second and then go into some discussion. So let me, without further ado here, the motion I'm going to offer is as follows. We, the members of the Greenfield Board of Health, strongly urge the mayor to enact a mask mandate requiring all persons above age 5, regardless of vaccination status, to wear face coverings in all public places in the city of Greenfield. So you got that, Nicole? You did get all of it? Are you muted?
Yeah, I'm muted. You're gonna have to either send it to me or say it again.
I'm happy to send it to you, but I'll say it again.
Okay.
We, the members of the Greenfield Board of Health, strongly urge the mayor to enact a mask mandate requiring all persons above age 5, regardless of vaccination status, to wear face covering in all public places in the city of Greenfield. Okay. And the mayor and I are in of different opinions about this. I'm just going to let you know. And what I would like to do now is elicit I'd like
I'll second that motion.
I'm sorry, who?
I'll second the motion.
Okay, great. Thank you.
Yeah.
Thank you. Okay, so we have a second of the motion. Now we can then open it up for discussion. And I would first like to invite our mayor to offer her thoughts about this.
Sure. I'm happy to do that. Yes, Nancy and I've had a couple of conversations today, plus conversations in the past. And I'm happy should this motion pass, I'm happy to take it for what it says, and certainly look into looking at all the numbers. We're guided and have been since the beginning by the data that we have, but also parsing out that data so that we know that it's the most accurate we can get for the city of Greenfield. So I will certainly take it and give it great consideration. I'm not opposed to a mask mandate by any stretch. I firmly believe that masking and vaccinations are what will eventually make the difference. The problem we have with this darn virus is that it does mutate. And so it keeps us ever on our toes, and it's very difficult. It's very much of a moving target. So I like to think that the vast majority of people in Greenfield have the good common sense to do what's right, to get to wear their masks in public places, and to make that decision for themselves and their families as they go forward. The numbers that we're seeing tell a slightly different tale than that, but I still think the vast majority of people in Greenfield do mask when they're out in public. So I will have to give a lot of give this information a lot of consideration. And of course, as I consult with the emergency operations team as well, what they're seeing, because it is the people on the front lines, the fire department, the police department, the health department. So I'm happy to take that motion if it passes and give it a very careful consideration.
Great, thank you. I'd like to invite our guests today to comment on this motion. I'll take about 10 minutes of public comment at this time. If there are any. Yes.
I think you were referring to me, yes?
Yes, I'm sorry, Jan. Yeah, I
Yeah.
don't have everybody's names in front of me.
Yeah.
Yeah, Jan.
Yeah, I would like to strongly urge the mask mandate. I'm part of the Lava Center in downtown Greenfield. There's Doug is also here from the board, and we also have staff members who keep that space open with as much attention to COVID safety as we possibly can muster. But when we are the arbiters of the policy, which what happens when it's not mandatory, it really puts us at into a very stressful situation, because we have people who come into the space who come in with an attitude that they don't have to do that, even if we ask them, because it's not mandated. And it makes it very hard to feel safe at times if somebody's really belligerent, and other times it's just disappointing that they come in and harumph that we are so audacious as to ask them to log in for contact tracing and they leave. If it's the mandate, that goes away, that attitude goes away. Maybe they don't come to begin with. I would just like to say, yes, I think, Mayor, that most people do have common sense to mask for themselves and their families. I'm not sure they have the common sense to mask for other people. And that's where I really feel, kind of put at risk, not directly myself, but we have family members who are extremely vulnerable, gone through cancer treatment, infants, people in those ranges that cannot be vaccinated at this point. And we also have patrons of the Lava Center who are in that position, and they are put at extra risk by not having it just be a mandate. Because if somebody comes in and says, I'm vaccinated, without asking for proof of that, and just trusting it, I begin to wonder, are they really vaccinated, or are they just taking advantage of that? I've wondered whether we should go to, in fact, requiring proof of vaccination, but that's tedious and difficult for a small staff trying to run a lot of things with all the extra things that COVID throws our way anyway. But at least a mandate from the city would enable us to say and to post, this is just the policy. Please don't attack us or give us grief about it. Please just mask inside. It's the law. It's not just a good idea, it's the law. So I'm very much in favor of that. And I know many other downtown merchants and proprietors who feel the same way. Thank you.
Thank you, Jan. I appreciate it. How many others would like to speak? Just a show of hands. I can't see everybody's hand. 1, 2, can't see below. Okay. All right. Just need to know time. City of Greenfield, I don't know who you are.
I'm Ellen Boyer. I'm the library director.
I knew you were familiar. Hi, Ellen. Thank you.
Thank you for letting me speak. So by its mission, the library, I believe, is the only municipal entity that serves everyone in Greenfield from cradle to grave. So I have customers who are too young to get vaccinated, who are too young to wear masks, in a public space with some people who won't wear masks if we no longer have a mask mandate in the municipal buildings. I know they won't. We are also a municipal building where you can come and stay all day. You can come to get warm in the winter, stay cool in the summer. You can come to dream, you can come to read, you can come to write your memoirs, but you can be in this building all day. So I agree with the previous speaker, Mayor. I would really like to continue to have a mask mandate that comes from somewhere above me, because I've experienced the same thing even now. When we went from a citywide mask mandate to a municipal building mask mandate, people argued with me that they did not have to wear their mask in the library. Library staff told me this morning at staff meeting that they begrudge the fact that they've now had to become the mask police. It's not part of their job, but it is right now. But if it came from someone higher than the library director that you needed to wear a mask in the building, it would be very, very much less stressful for my staff, and I think less confusing for the people who come in the building. And Jen, you said something when you were talking about Kelly. You said by protecting the public, you also protect the individual. We need to protect everybody who's in my library. Those teeny tiny little kids are the ones that really worry me right now, especially Megan, hearing that that's the age group that's infected now. So I would strongly encourage that we have a citywide mask mandate. Thank you.
Thank you for your comments, Ellen. I appreciate that. Doug, you were next.
Thank you. Yes. I'm also from the Lava Center, and I want to both ask a question and make a comment. Public space, I'm not exactly sure what that means. Is a private business considered a public space? So I hope there's clarification about that when the motion is voted on. Maybe it'll come out tonight. But whatever it is, so is the Lava Center considered a public space?
It
I
is,
will.
it is considered a public space.
Okay, thank you. So a clear definition would help. I wanted to respond to the mayor's comment that most people in Greenfield are responsible and carry, wear a mask. I agree with that, but it only takes one person who is not responsible to actually compromise an entire building. And so, a mandate includes everybody, not just even if it's 90% of people who are responsible. If 10% are not, that puts everybody at risk. So that's one piece of it. And the pressure it puts on vendors, on people who are in buildings all day is immense. Not just the library, but this is of course shopping season. It's the holidays. People are coming together. There are events happening, whether they're the Hawks and Reed party time or stores. We hope people are going in and spending money in Greenfield, and good for our economy, but that means they're all gathering closely together. So at a time when numbers are going up, it seems like a mask mandate would be really crucial for this season. I mean, we're going inside, it's cold, it's dark early, we're going inside, we're gathering together. Why wouldn't we make sure that the people who go inside are being as safe as they can be, and a mandate would help do that? Thank you.
Thank you, Doug. I'd like to ask if there's anybody in the audience here who is opposed to a mask mandate who would be interested in speaking. Okay. Alyssa, you had your hand up. Did you want to say something?
Oh, I just had a few questions when it came the board's time to discuss.
Sorry, hold on a second. I see someone in the chat. I'm sorry, I'm not very good with the chat thing. Someone said yes in the chat. Alyssa, just hold off a second. I'm going to come back to you.
Yeah.
Dawn, is that correct? And you're muted there. Okay.
Hi.
Go ahead.
Yes. I just want to, instead of people regarding mask mandates, the state has been going by numbers, and I just feel like listening to everybody, it's like, I feel this, I feel that, I feel this, like I'm feeling scared, or not distrustful of people. Just keep it with the numbers and just keep focused, because a lot of places have dropped it, and a lot of people keep saying, well, I'll go there instead because I don't have to wear a mask, and that's going on. Just remember the big picture before. That's just basically my comment is, I don't know, I just feel like it's being run by emotions right now and not numbers or statistics or statewide what numbers are. I don't know. So that's my only comment. And I know there'll probably be an uproar if another one goes into place so quickly after it was dropped. I think people are really tired, like everybody is,
Yeah.
of the whole thing, So, okay, I'm sorry. That's all I had to say. Thank you for your time.
I appreciate your comment. Alyssa, you're next, and then Jen.
Okay. So I know we had some debate over, or there's been some debate over whether we recommend or we actually put
We
forth.
have the authority to enact this, in other words.
Okay, and so that's been determined.
Yes, we
Okay.
actually do have the authority, but there's a few issues. One, we have to notify the public, newspaper, and the other is there's some details about that I need to dig into. It has to be narrow in scope. There are a couple of legal things that I need to be more certain of before I would be willing to step out and say we're taking the authority to do this. So
Okay.
we actually do have the authority.
Okay. And then Is that in the Northampton? Like, is that similar to the Northampton mask mandate? And can we get a copy of that? I couldn't
I
open the
actually sent it.
attachment.
Yeah, I
know.
sent, yeah, I know, I sent it to you, but we do,
Okay.
as you see, theirs is quite detailed and covers things that we probably wouldn't, but it's
Okay.
certainly, it's a good reference.
Okay.
And, yeah.
Is that just I can just Google that, right? Because I
Yeah, I
couldn't
mean,
open that attachment.
just remind me tomorrow and I'll make sure
Oh,
that
okay.
I'll open it and
Okay.
send it to you in some form.
So would we be voting today to do something similar to that, or would we be or would we be discussing that and then calling another meeting to vote?
Okay, so today, I've offered up a motion. There's a second. So there's a motion on the table.
Yeah,
We're
no,
gonna vote on that.
on that motion. Okay, if we
That's
should
what
move
we're
forward
voting
on
on.
that. Okay, and then I guess my other question in terms of like, so like, recommendations, do I think we should recommend everyone should wear a mask inside in public spaces? Yeah, sure. I that is my opinion. But I'm curious like how we go about like enforcement. And I'm also curious like how folks handle things when, so like I work in a health center, we have to enforce a mask mandate that never went away in healthcare. When folks come in and say that they can't wear a mask, and like, do we just roll with that? Like, I know what we do at my work, but like, does somewhere like the Lava Center have face shields that they're going to give out to people? Like, how are we going to handle that? And then the second part of that is, what do we do around eating and drinking inside at businesses if we are
Yeah,
enforcing a mask mandate?
those are all really valid and good questions, and we can't really go into those kinds of details at this meeting today.
Okay, okay, great.
We'll, it's definitely for consideration as we move forward.
That
with-
makes sense.
yeah.
Thank you.
Yes. Jen,
So I just got, Megan and I just received the email from the state and they just give generalized numbers. So the dates, I literally just got it from November 14th to November 27th, Greenfield had 96 cases from the state that's documented. And about this time last year, when you saw that screen thing pop up from Megan, she was trying to show her graph and we're trying to figure that out. But the other thing about enforcement, what we do now is the health department when it comes to enforcement is if a business has several employees who are positive, we actually, there it is, we actually close the business and get that stabilized so the public is not affected. Individual, I think on another end, when the mask mandate was around before, we were there as support, and if there were supplies that were needed, we would help. But we're not really ticketing people, or we have not in the past ticketed people, or fined people, but we have closed businesses down. It's very noticeable when it happens. We get called all the time. Why are they open? What's happening? So, so that's one big way of enforcement because we have to try to stop it that way. Megan, I see you have that graph up, so you can explain that.
if we see the graph, Megan. Did we lose her and got her graph instead?
Meg, let me see. Oh, that's fancy.
Yeah, I don't.
I mean, it's helpful to have the cases to date. But again, this year and last year are really, really different. So,
Yeah.
were just really different activities. Nobody was going out to eat inside last year. No one's
Yeah.
going home for the holidays last year. So we are going, this is not a statement on whether there should or should not be a mask mandate. Again, I think the smart thing to do is wear a mask inside in public for everybody, regardless of vaccination status. But we're always going to see more this year. And I think that's just an important thing to remember.
So I'm off mute now, sorry.
Oh, good.
So sorry, I couldn't figure out how to get off of the stop sharing screen. So one of the things is last year we only had 50 cases. This year we're at 160 for the month of November. And I just kind of wanted to show the big spike between November and December. Last year we had a huge spike in December. It was like, I had 200 and something cases. It was so hard to control, you know, it was just awful. And I'm afraid that if we're already starting at 3 times as high as we were last year, that next month is going to be disastrous. Right now, I already have businesses that are closed because of COVID and, you know, departments that are suffering because their workforce is out, you know, and it just seems like it's already starting to feel out of control. And I'm not saying this in a scared place at all, because it doesn't matter to me, really. I'll wear my mask and I feel like I'm okay. But just the whole city of Greenfield is just kind of spiraling, that it's different than last year.
Okay, Peg?
Nancy, can I say a couple things real quick? Can you hear me?
Oh, Kelly, you're speaking? Okay, go ahead.
Hear me? A couple of things. I think I saw Don too. That you may have missed some of the numbers. We did actually give some numbers, Megan and Jennifer both prepared and gave us numbers that were current to Greenfield. And I'm not sure if you heard those numbers, but I wanted to make sure that you knew that we did discuss those just a short while ago. And I don't know if I want to say any of the other things, but I do. You know, as a healthcare provider and somebody that's been directly involved with this for the whole interim, you know, I think, you know, we need to do our due diligence, and we need to think about not only ourselves and our immediate family and friends, but the greater, larger community. And if that means that we have to, you know, do this multi-layering of masks and vaccinations and social distancing and things like that, you know, it sounds like that's where we're heading, whether we want to or not. It is a very different season and year because of the vaccinations, you know, that has been able to help quite a bit. But, you know, we're not out of anything yet. I mean, this is going to be ongoing, and I do fear, like Megan, that this is going to be much worse than last year at this time if we don't take action as a community.
Thank you. One more comment, and then I'd like to call the question. Peg?
Yeah, thank you. I had not been planning on speaking on this issue, but I have never stopped wearing a mask indoors. I know that your current motion on the floor does not include the word indoors. I would specify that plus any outdoor spaces where you're not able to social distance. So I would make that modification. And as far as following the science, you definitely want to, but it's not really following the numbers. It's following the trends, which means you want to lead the numbers. You want to get ahead of the numbers. I don't want to wait until everyone is sick to put something in place. Thank you.
Thank you. My intention, thank you, I appreciate that. And my intention with the language was indoor public places. And, you know, I just didn't include that. So we can either do an amendment, but if the board is okay with that understanding, we can just move forward with the motion, and then we'll just add the word indoor. I appreciate your comment, Peg. So without further ado then, I would like to ask for a vote on the motion. Yes, Alyssa.
Oh, I do think we should amend it.
Okay, great.
Yeah, I'd like to offer an amendment to add the language indoor public spaces.
Thank you. Appreciate that. A second to the
I'll
amendment.
second that motion.
Okay, all those in favor of the amendment?
Aye.
Great, so that's added. Thank you. That was not so long. Appreciate it. Okay, so now we're back to voting on the original motion with the amendment. Don't need to read it. I assume everyone's okay with it. Okay, you understand it. All right. So all those in favor of the motion on the floor? So.
Aye.
Okay, 3. So no opposed. 3 in favor, no opposed. Okay, thank you. Motion carries. Thank you very much for all of your input, and I really appreciate it. We hope for the best in the future, but this is a tough opponent we have. COVID is, man, toughest I've seen in my lifetime. So, okay, moving along then, we have, what's next? So Jen, you've got the, yeah.
Mr. Singleton's raising his hand.
Yes. I don't see him, but yes. Yes. Oh, there you are. I'm sorry. Go ahead. You're muted.
Different. Is it okay?
There we go. Yes.
I just wanted to comment that one of the things that some of us have been pushing for in Montague, and maybe this is a work in progress. Number one is better collaboration on these issues between Montague and Greenfield. Something to think about. It drives me nuts when I go to Food City and 70% of the people aren't wearing masks. And then you guys have a mask mandate, and I go up to Stop and Shop and I go to both places, and most people are wearing masks. I know there's obstacles, but I hope that we can work in that direction. And the other thing in Montague, and I can't speak for Greenfield, I think we can improve communication with some of the key businesses, or at least think about ways we can do that. I know everybody's busy, but I talk to people all the time as a reporter in Food City, and I just feel like they could be perhaps talked to a little more somehow.
Nancy, may I respond?
Pardon?
Can I respond to Mr.
Yeah.
Singleton?
Yeah.
So, Mrs. Singleton, I'm honored to say that we were just awarded a shared nursing services grant with the towns of Montague, Deerfield, and Sunderland. That's going to absolutely improve communication. I am in communication with someone on your board, as well as the health director, Dan Wasiuk, and we do discuss what we're all doing. I discuss with Carolyn Ness in Deerfield what they're doing. And we are definitely, there is a lot of open communication between the municipalities, which I really enjoy and like. I do feel that that will improve more as this grant goes through, because we have to work together and collaborate together with the nursing staff. So I see more communication now than ever between these towns, and I think it's going to even improve more so with this grant. So I hope that answers your concern. Thank you.
Yes, Mayor.
Addressing Jeff's concern as well. Director Hoffman is correct. I think that grant with the shared nursing services will help a lot in the area of communication, but communication is a two-way street. So we invite Montague to take part in that communication vigorously. But at the end of the day, what we do in Greenfield is what we vote to do, and we cannot tell Montague what to do. So it's up to your Board of Selectmen to decide what they want to do with the mask mandate.
Thank you. Okay, Jennifer, do you have of the list below here? Do you have anything which is crucial to discuss?
Um,
I have one thing that I actually, before you answer that question, I just want to skip down to the Portland Lou allocation because I believe that the mayor has gone to bat for that, and I want to acknowledge that that's been very important for this Board of Health. So I want to acknowledge that and thank you before you disappear from our screen. So thank you for that.
Thank
Well, you're
you.
welcome. Who knew?
Yeah, right.
You know, and who knew they were so damn expensive, but
Yeah.
whatever.
Right.
We will have to find a location that's suitable.
Yeah.
It's nothing, it's not a porta potty. You don't plunk it down wherever.
Right.
When it's down, it's down, and it
Yeah.
has to have water, and it has to have sewer, and it has to have a lot of things. So, but I've committed to exploring that and using some of the ARPA funds to at least get the one, and the rest are in the capital budget.
Great. Well, I wanted to publicly thank you for going to bat for that one.
Thanks.
Okay. All right. Back to my question for you, Jennifer.
I'll make it quick. There was supposed to be someone at the meeting tonight, but I think she is under the weather.
Yeah.
And that's why she's not present.
Okay.
But I'll propose it to the board. She was wondering if we would be willing to put public health alerts on Facebook or on our page on certain events that are kind of critical to get out quickly, or things that are happening in different states. I'll give an example that there has been fentanyl found in marijuana, and in Connecticut and Vermont. And it's just kind of putting an alert out to the public so they're aware. And I wanted to, and she was going to give it a little bit more discussion about that, but that's what the public health alert is. It wouldn't be for everything. It would be more for getting information out, and it would be an alert system type thing. So I'm just proposing that to the board on her behalf. Like I said, she was supposed to come in and speak
Yes.
about that, but she's not present.
Yeah, this is Sarah Ahern. Can you tell me what organization she represents?
Sarah,
She works for several places. She's an advocate in the city, but she works for the Recover Project. She's also on the MRC, the Medical Reserve Corps.
Okay.
She's a very, very big in the opioid task force.
Okay.
But she really is a friend to the homeless population in our community. But I speak to her, here and there with certain topics that that the health department faces, and other grants that we're working on right now. And she brought this up to me, and she was hoping to be here, but again, I think she's a little under the weather. So I just wanted to propose that, and so it was out there. And if you wanted her to come next time, that's fine, or if you wanted to just discuss it.
Yeah, I guess what I would request is that she just email us with her proposal, and just be so that I'm a little bit clear about what she's looking for. And yeah, I don't see any problem with it. And she wants specifically, so we have a Facebook page, the health department.
Yes, the Greenfield Health Department has its own Facebook page.
Okay.
as does the city of Greenfield.
Yes, that one I knew. I didn't realize we had a separate one. Uh-oh.
I can say that that it's actually in Massachusetts too, because it's in the community where my grandchildren live, which is in Littleton. So it's not very far away.
Yeah. You mean that there's public health alerts?
Well, both public health alerts, but fentanyl and discovered in the marijuana.
In marijuana problem. That's a big problem. Yeah. Yes. Okay. Good. Thank you. All right. Let's see. do you have, so Jennifer, looking at the list here, let's take only what we have. It's 1 minute before 6. So we're not going to do the review of comparative fee schedule because you're going to, right?
I want to tell, yeah, what we discussed about tightening a couple of things up.
Yeah.
It's a no significant restaurant update. Everyone's been compliant. The regulation of rental properties, I think that's a much bigger discussion than
Okay.
0 minutes left.
Okay.
But I, right, and I'm trying to think. And as for properties, homes under the receivership, I have a court date in that was now moved to January for the 2 properties that we have been discussing. And the Attorney General's office is looking at that 3rd property because of the delay in them being compliant and now not paying the fees that have incurred.
Okay, great. And any comment about, excuse me, 5153 Place Terrace?
That's the one I was discussing with the Attorney General's office.
Okay, because, yeah, all right. Okay, I think that's it. And any other issues anybody needs to bring up on the board or, okay. Okay, we've got a Glenn, okay.
Were you holding a public comment period?
Well, that was, I actually moved that to be part of the mask mandate, but I'm happy to have your comment, Glenn, if you'd be willing to make it brief, I'd appreciate it.
I will try to make it brief. Thank you for indulging me. I just wanted to say that I spoke at the City Council meeting on the 17th, and I'm sure that some of you have heard that the issue was raised about the, we'll say, ongoing cleanup at the Lunt facility. And I just want to say that I didn't mean to come across as being negative about what has been accomplished at that site. I think a lot of good has been done for redeveloping that property, but the emphasis has been on economic development and logistics. And I felt that the missing piece was public health and community health. And if I am wrong, I would like to know if the Board of Health has been involved in that process, in that cleanup process. Today we submitted a petition to the city to have the site designated as a public involvement plan site, which means that we'll have to open up the process to much more public involvement and transparency, because there is still a lot of contamination remaining at the site and indications that that contamination has migrated off-site into the adjacent neighborhood. And so I encourage the Board of Health to get involved in the process. I understand that in the not too distant past, there was no health department at all. It was obliterated by the previous mayor. And that is a legitimate excuse for the health department not being involved in the process in the past. But now I think there's a need to have public health represented in the cleanup of the property. And I hope that this public involvement plan process will provide that opportunity for more involvement on behalf of public health. And I encourage the board to get involved and the health department to get involved. And that's the extent of my comments. That will be a process that will be starting soon. And I look forward to working with all of you on making sure that we are addressing the concerns of public health and community health with the ongoing cleanup of that property. So thank you for this opportunity to provide those comments.
I really appreciate your comments, Glenn. It makes sense. Something I hadn't thought about, but I appreciate you bringing it up and making me aware and all of us aware. We hadn't been. Thank you. So I want to talk about the date of the next meeting. I will be gone the first week in January. So I would like to have our January meeting on Wednesday, January 12th. Is that okay? That's okay for you, Alyssa? And
Yeah, that works.
good. Jen, does that work for you? Okay, great. Good. Okay. So next meeting, next official meeting is Wednesday, January 12th. And with that, I say let's adjourn.
I'll second that.
Thank you. All right. Be well, everybody.